On June 30th, 2019, Lizzie Stoltz called her husband Sean to tell him she had just gone into labor, 30 weeks into her second pregnancy.
He said right away, "You're kidding." And I said, no, I'm positive my water just broke.
The couple lives in the small northern Wisconsin town of Bloomer, population roughly 3,500. Lizzie had planned to deliver her second child at the Mayo Clinic Health System Hospital in Eau Claire, about 30 minutes away. However, it soon became clear that wouldn't happen. Her contractions were coming on too strong. So she went to the closest hospital 3 minutes away, Mayo Clinic Health System in Bloomer. The hospital is staffed 24/7, but there's no labor and delivery service or a neonatal intensive care unit. Physician assistant John Farm was working the emergency room and had 5 minutes to prep for Lizzie's arrival.
That's the first thing that crosses my mind, is to assemble the appropriate resources and team to be able to take care of the patients that are coming in. So that's what I did. I called Dr. Score, and then I called the transfer line in Rochester and told them that I'm going to need some telemedicine help as well.
Telemedicine allows medical providers to communicate and see patients from an off-site location through a machine just like this. Dr. Christopher Kalura, a Mayo Clinic neonatologist in Rochester, Minnesota, quickly appeared on the telemedicine machine in Bloomer, ready to assist John.
We have controls in order to zoom in on different areas of the room and improve our audio, talk to providers with a handset if needed. Short of us standing right there with the team, it's the next best thing.
By the time Lizzie arrived at the Bloomer emergency room, she was ready to push. By now, on-call family medicine physician Phil Score had arrived at the hospital. Together, he and Dr. Kalura, over 100 miles away, worked to deliver the baby.
It was literally like having a specialist looking over your shoulder. And there was times where he would pan the camera and have a conversation like, "Hey, what's your name? Okay, we're gonna do this is what I want you to do." And yeah, it was remarkable.
The baby was finally delivered, but she was bruised and not crying.
She was very limp and blue and not breathing.
John intubated the 3-pound baby named Madelyn Grace. Through it all, Dr. Kalura remained by his side on the telemedicine screen, taking the guesswork out of caring for such a premature newborn. A Mayo Clinic neonatal flight crew then took baby Madelyn to Mayo Clinic in Rochester, where she would receive care for the next 44 days. Madelyn had become the first baby born at the Bloomer Hospital in years, and the first with the support of tele-neonatology.
Gets the patient the right care at the right place at the right time. That's what telemedicine does.
Madelyn is now thriving and getting used to life at her real home.
It's broken sleep with a lot of smiles.
Yeah.
That's what it is. She's going to be demanding. She'll be a fighter, that's for sure.
For the Mayo Clinic News Network, I'm Kristin Everett.